Welcome back to Capital Review. Washington, D.C. is feeling the effects of a worsening winter surge during the holidays, and we're talking to state epidemiologist of the D.C. Department of Health, Dr. Anil Mangla, about the spike in coronavirus cases in the district. So, Dr. Mangla, reports show that the Omicron is spreading a lot faster than the Delta variant. What does that mean? Does that mean that it's deadlier? And for those who are unvaccinated, what should they know about that?
Yes, to answer that question, let me go into the pathogenesis of the variant or the new Omicron variant. So number one, it's not deadly. We don't know that because in the US, effective today or by yesterday, we just had one death, right? That was related to Omicron. So it's not deadly. However, it's very contagious. Now, to understand the contagiousness of this disease, let me go into the structure of the Omicron variant. So when you look at the virus, it has different components. There's over 50 mutations in this variant. Out of the 50, there's about 36 that are in the spike protein, right? So we hear about the spike protein. So what is the spike protein? The spike protein has certain components in it. One of the key components is it's called the receptor binding domain. This receptor binding domain actually binds to your receptor, your membrane in your cell. And so because of this large amount of mutations in this area, it's a much tighter bind. Because of that much tighter bind, it enters your system much stronger and faster. So that's kind of giving you that perspective. And because of that, it's going to spread and transmit much more. The second part of that spike protein is called the furin cleavage site. This area is where the fusion occurs. And because of the mutations there, you're going to get this going into your membrane much faster, and this causes larger amount of infectivity. So having said that, these mutations within this variant also causes the virus to replicate more than 70 times faster than the Delta variant. Because of this replication, it has been shown in the laboratory that it actually accumulates in your bronchial and respiratory tissue. Right, so that's why because of the spread, because of the large viral load, if someone breathes, sneezes, talks, doesn't have a mask, you're going to have this airborne. And that's why the spread is so quick, because it replicates that fast. You're getting much more viral load going out. And that's why what is happening is the incubation period is much less compared to the Delta. So people are getting actually exposed and then infected within almost 2 days compared to 3 to 5 days with the Delta variant. That's why very infectious, very transmissible, and that's what we've seen with this new Omicron variant.
That makes sense. Thank you for breaking that down. So now it's Christmas weekend. Next week is New Year's. People are going to want to get together. So what's DC's health recommendation for gathering for the holidays?
Right. So as we know, it's family time. People want to be together. The key component here, as I have said, it's airborne. So, try to be assessing your risk. Try to assess your family's risk. Key component, wear a mask, right? The mask is going to protect you. It's going to protect others because this is airborne. So wear a mask. Try to keep a distance. Try to avoid crowds. Try to avoid gatherings. And if you're having a family gathering, try to make sure or assure that people that are coming to your family are vaccinated, right? That is the key. So how I look at it and how we as epidemiologists and public health officials look at this is it's called the layered mitigation process. And when you look at it layered, vaccinations come number one, wear your mask, social distance, avoid crowds, and take care of your health and try not to be selfish in this respect, because you want to help your wellness, but you want to help others' wellness. This is going to mitigate the cases here in DC substantially.
And what's the recommendation for children and students right now? What are you advising families to do in the meantime?
Yes, so we recommending families, number one, again, make sure you get vaccinated if you're not vaccinated. If you're eligible for a booster, get your booster. As for students and as for kids that are on holidays, try to avoid travel as much as you can. Try to get tested. And before you come back to school, make sure that you get tested. If you have symptoms, get tested. And if you're sick, stay at home. If you test positive, make sure that you isolate. But the important thing is, even if you're doing this home over-the-counter test, if you're positive, DC Health has a portal for over-the-counter. Send that test result to DC Health. We will then get a contact tracer to make sure that you get a call. We provide you guidance in isolation and in quarantine.
Thank you. State epidemiologist at DC Health, Dr. Anil Mangla. Really appreciate your time and for being here on Capitol Review.
Thank you.
And we'll be right back.